Hello everyone, this is Dr. Tidman. Thanks for stopping by my YouTube channel. Please remember to subscribe and hit the notification bell so you'll be informed of my future videos. This is part 2 of my Caregiving 101 series. What about rehab? This video is based on my book, Families in the Rehab Center and Beyond, and I will post that link to the book on Amazon in the description. This series is really based on my 45 years of experience in healthcare practice as an occupational therapist. I found that families and patients were really lacking adequate information about how to navigate a hospital, which you saw in part 1. It was quite long. And then what about a rehab center? How do you navigate that in this part 2? Parts 3, 4, and 5 are coming up. So check in on Mondays when I post a new part of this current series. I thought it might be helpful to you to have access to some quick videos that review some important concepts in each of these areas. If you've had a family member or maybe you yourself have ended up in a hospital and then in a rehab center, it can be quite frightening and very confusing. So I hope that you gain some knowledge from this video, and if you do, make a comment in the comments below. So this part will just kind of introduce the concept of rehabilitation. In the rehab center, what are the different types of rehab placements that you will be placed in? Because they all are very different with very different criteria. How do you engage the rehab staff? What's some of the terminology and discharge planning that you'll have to think about? And then my final tips and takeaways. These parts really build on each other. So if you did not see part 1 in the hospital, go back and review that one. I go through power of attorney in great detail in that video. So the different types of rehab. There is acute rehab settings. These are facilities that have you participate in 3 to 5 hours of therapy every day with a max stay of 10 to 14 days. These are not long-term rehab facilities. These are very short-term for acute conditions. For example, you broke a leg or you broke a hip and you're pretty active anyway. And you could potentially rehab in about 10 days and go home. I typically find that acute level rehab situations are not appropriate for elderly people who have been sedentary or people who've had significant trauma or a stroke or a head injury. These rehab settings are way too intense. So think about whether your family member can participate in 3 to 5 hours of intensive therapy per day and be well enough in 10 days to go home. You got to think about that. The second level of rehab is what we call skilled rehab. These settings are between 2.5 hours, or up to 3 hours of therapy per day. The maximum length of stay for skilled rehab when someone has Medicare insurance is up to 100 days. The first 20 days are covered at 100% by most Medicare plans. Starting on day 21, you will have a 20% per day copay. And unfortunately, many people don't know that. So they push to stay longer. They get approved, and then here comes the bill. So really be aware of what your Medicare plan covers. Sometimes if you have primary Medicare Part B and a supplement, the supplement will help pay those copays, but you have to be informed about what your coverage is before you're admitted to a skilled rehab center. And then we have long-term care. Long-term care has a very limited to no rehab associated with it. Long-term care is a long-term living situation for patients who are pretty dependent in their status. In other words, they need moderate assistance with all of their activities of daily living, which are toileting, dressing, bathing, those kinds of things. They're dependent for mobility. Maybe they're in a wheelchair. Long-term care really doesn't offer a lot of rehab. Now, keep in mind, when you or a loved one's in the hospital is when they evaluate you for what's next. And typically someone from an acute rehab facility or a skilled rehab facility will come to the hospital to evaluate you. If you're not up for 3 to 5 hours of therapy per day, they won't move you there. You won't qualify. So be aware that those evaluations in the hospital are very important. And that is the time when the family needs to be present. I've seen it over and over in my 45 years. These liaisons come in from the therapy facilities, no family is there, and out they go, and nobody knows what they found. They don't know the patient's living situation. So believe me, family members, you want to be there when they're evaluated for what the next steps are. So let's talk about some of the therapies and services they'll receive in rehabilitation. I'll indicate whether these are true for both acute and skilled rehab. Most of them are available in both, but to certain degrees. So physical therapy, for example, which looks at mobility, strength, balance, and any need for equipment, can be done in a skilled facility an hour per day. And in an acute setting, could be 2 hours a day or more. Same with occupational therapy, which looks at all of your activities of daily living. And this is just a very limited list of what occupational therapy does. They really help someone regain independence in toileting, showering, dressing, feeding, bathroom, room mobility, equipment needs. Not to mention some of the cognition that they can work on, memory and sequencing. And I always say that occupational therapy bridges the gap between physical therapy and speech therapy. We kind of cover everything else. Occupational therapy in a skilled setting can be about an hour per day, and in an acute setting could be more like 2 hours per day. So then we get to speech therapy. This is just a few of the things that speech therapy works on. Verbal fluency and memory and cognition, feeding with the chewing and swallowing, and they work with OT on some of the motor skills involved in chewing and swallowing. Receptive language, functional language. So they really cover a lot of the communication piece. Even augmentative communication if somebody is nonverbal. Again, in an acute setting, people could have 1 to 2 hours of speech therapy per day in addition to the other therapies. Doctors and nursing. So once you leave the hospital and you're admitted to either an acute or a skilled rehab facility, your primary care doctor is no longer involved in your care. This is something that they don't explain to you. The doctor at the facility, who is typically called the medical director, I've heard them called medical administrators, are the ones who oversee your medical care, your medications, all of that in a skilled or acute rehab facility. They will be your doctor until you are discharged. Nursing. They're responsible for medications and dosing, management of your pain levels, wound care if needed. And then the doctor will refer you to other medical specialties while you're there in their rehab facility. Now, the CNA, certified nursing assistants, in some places they're called nursing techs, are responsible for the day to day with your family member in the room, helping with dressing, showering, grooming, hygiene, toileting, those kinds of basic needs. Now, the thing to keep in mind when you were in the hospital in an ICU setting, there was one nurse to every 2 patients. Then maybe you moved to a floor unit where there was one nurse to maybe 6 patients. In a rehab facility, it may be one nurse to 25 patients. Your CNA, your certified nursing assistant, may have 15 patients assigned to them. So keep that in mind when you're wondering, why have I not seen a nurse and I've been here 3 days? So keep that in mind. The ratio is very different in a rehab setting than it was in the hospital. So there's a social worker involved in your care at an acute rehab setting or in a skilled rehab setting. They are primarily responsible for liaising with your health insurance. They're responsible for starting to evaluate options for discharge. They assess with you and with the family home needs for services. They make referrals to home health prior to discharge. And again, they take care of Medicare or other insurance appeals for length of stay. Did you know if the insurance carrier limits your stay to a certain number of days, you have the right to appeal that as the family. So don't just take the "you're going home tomorrow" as the gospel, because you can appeal that if you feel like you need more time. There's a nutritionist or dietitian at the facility where you'll be staying for your rehab. They take care of dietary prescription and they coordinate with food services. These are the people that you talk to about your food allergies, food preferences, food sensitivities. So I covered the POA, the power of attorney, extensively in the first video in these series. So what I wanted to cover here is the patients and power of attorney rights and responsibilities. And really, both of these lists apply to both people. Because in essence, if you are the power of attorney for your mother, most states in their law says you are your mother in terms of making medical decisions. This alone was the single most important document I took care of when I took care of my mother and my mother-in-law. Without them, I would not have had any of these rights and responsibilities that I'm going to tell you about. So, as I said in the part 1 of this series several times, be sure that you take care of getting a medical power of attorney for your family members, even if they are just fine. That includes your spouse, by the way. Because in some states, just because you're married to someone does not give you the right to all of this. So you need to know that. So you have the right to be informed of the results of your evaluations. You have the right to be informed of any changes or recommendations for medications. You have the right to be informed of the therapist's goals and objectives for treatment and actually participate in setting those goals. You have the right to be involved in decisions about your discharge options. They can't just tell you where you're going. You have the right to obtain needed equipment to maintain or improve your independence. Power of attorneys, you have the right to all that the patient has the right to. You have a right to appeal the length of stay determinations by your insurance carrier. If you're making progress and just need a little more time, your therapist should help you write an appeal. You have the right to participate in all decisions about your medical care, goals for therapy, and length of stay. You have the right to call a patient care conference at any time, where you can meet with the administrator of the facility, the medical director, and the therapists. And you all can have a conversation about your goals, about your discharge plan, whatever it is. You can call that conference. You don't have to wait for them to. So, final tips and takeaways. This is a brief list of an hour lecture that I could give you on this. Bring your power of attorney paperwork with you everywhere you go. POAs, have it with you. Provide copies to the hospital and the rehab facility. Visit the rehab facility at random times and observe the nursing care and the therapy sessions. The therapists are not allowed to tell you that you cannot observe their sessions. You can observe their sessions. Call a care conference when you need to communicate with the staff and therapists. Ask therapists to provide you with their notes and their written goals for therapy. Meet with the social worker early, maybe even like day 1 or 2, to talk about the timeline for therapy and discharge. Again, visit your loved one randomly throughout the day. Be available. Be present. I cannot state strongly enough how important this is. Thank you for viewing part 2 of my Caregiving 101 series. To catch up, if you didn't see part 1, go back and see part 1 on my YouTube channel. Part 3 will be posted next Monday. So be sure to check in, subscribe, and hit the notifications so that you'll be informed of when the next part of this series is posting. Thanks again, everyone, and take care.